Hi, my name's Ayla Weatherhole, and I'm going to demonstrate 3 types of injections: intramuscular, intradermal, and subcutaneous. To start the video, I'm just going to state the gauge and needle length for each injection. For intramuscular, you would use a 20 to 25 gauge needle, and the length would vary depending on the injection site. For the deltoid, you're going to want to use 1 to 1.5 inch, and for the ventral gluteal, you're going to want to use 1.5 inch. For the vastus lateralis, it's going to be 5/8 of an inch to 1 1/4 inch. And then for the subcutaneous, you're going to use a 25 to 30 gauge, and it's going to be 3/8 of an inch to 1 inch in length. And then for the intradermal, you're going to want to use a 25 or 27, and it's going to be 1/4 of an inch to 1/2 of an inch. And then for the actual demonstration itself, the first thing you always have to do is do your 3 checks, 2 in the med room and 1 in the patient's room. And you also always want to keep in mind your 11 routes of med administration. Okay, so to start, I'll do, first thing you always want to do before you do any type of med administration, you want to do your hand hygiene and check the patient's wristband for their name and date of birth and verify the order. You will also always want to make sure you ask about allergies. And then after you've already found your injection site, you're going to want to put on some gloves and clean the site, starting from the injection site going outwards in a circular motion. And you want to let that air dry. You don't want to wave it or blow on it or anything like that. And then after it's dried, you'll take your needle. This is an intramuscular injection. You want to take your needle, and normally you would do the Z-Track method, but where this is such a small surface right here, you're going to just hold back and push down on the skin, and you're going to insert your needle at a 90-degree angle. You're going to stabilize at the base and insert the medication. Remove at the same angle that you inserted it, and don't move the hand stabilizing the skin until after the needle is already removed. You would activate your safety and put it in the sharps container, but where this is just practice, I won't actually do that. You're going to remove your gloves, do hand hygiene, report and record, and monitor for any adverse reactions. And for the intradermal, you're obviously going to have already done your 3 checks. You still are keeping the 11 rights in mind. You're going to do your hand hygiene, put on gloves, clean the side, all of the starting steps, the same as the intramuscular. After you've already cleaned your site and it's already dry, you're going to take your needle, remove the cap, make sure you have the bevel side up, insert at a 5 to 15 degree angle, inserting about 1/8 of an inch. You're going to make sure it's just barely under the skin. The bevel is completely under the skin though. Stabilize at the base and insert at a 10 second per milliliter rate. Remove at the same angle you inserted it. Activate your safety and put in the sharps container. You're going to remove your gloves, do hand hygiene, report and record, and monitor for any adverse reactions. And for your subcutaneous, you're going to do your hand hygiene, put on your gloves, clean the site. You've already done your 3 checks, and you still have the 11 rights in mind. You're going to remove after the injection site is dry, you're going to remove the cap, and you can do a subcutaneous injection at a 90-degree angle or a 45-degree angle, depending on the fatty tissue. If it's pretty fatty, you're going to pinch the site and go in at a 90-degree angle, and then pull out at the same rate or the same angle you inserted it. Activate your safety and put it in the sharps container. You're going to remove your gloves, do hand hygiene, report and record, monitor for any adverse reactions.